Kidney disease is projected to be the fifth highest cause of life years lost worldwide by 2040. Currently, 3.2 million people in the UK live with moderate to severe chronic kidney disease. Kidney transplants are the single most effective treatment for people with end-stage kidney disease, and the number of kidney transplants required globally is expected to double by 2030. Following a transplant, patients are reviewed frequently for the first year and beyond. 1 in 5 patients will experience acute rejection within the first year, and complications can arise at any time. Crucially, patients often do not have symptoms in the early stages of transplant rejection, which can cause difficulty with early diagnosis. The gold standard for diagnosing kidney rejection is to take a core needle biopsy and study the tissue. However, these tests are invasive for patients, time-consuming, and expensive. In current clinical practice, serum creatinine is used as a non-invasive marker of kidney function, but it is not sufficiently sensitive or specific to detect transplant rejection. Patients can also display stable creatinine levels in the early stages of acute rejection. Typically, patients are admitted for observation and a core biopsy taken from the affected kidney following a spike or steady increase in creatinine. There is a higher chance of prolonging the life of a kidney transplant if the patient can start therapy as early as possible in the rejection process. This means that technologies capable of rapid, non-invasive, and accurate identification of acute kidney rejection are crucial, and IDxSense has the potential to provide this. Our novel chemical sensor can measure granzyme B activity, a marker for human cell overactivity associated with transplant rejection. This can be quickly tested in human urine as part of a fluorescent immunoassay. We have demonstrated a positive predictive value of 89% when measuring kidney transplant rejection using our diagnostic test, compared against a core biopsy standard. Serial granzyme B activity levels have also been shown to correlate with successful response to treatment. Use of this technology as part of the current kidney transplant diagnostic and monitoring pathways would allow clinicians to assess patients for subclinical rejection more frequently, provide earlier detection of rejection and quicker treatment, overall having a positive impact on patients' health. Granzyme B is a key protease enzyme found in T cells. It is activated as part of the inflammatory response, being secreted by T cells to initiate controlled cell death, or apoptosis, of target cells. Granzyme B levels are minimal to absent in healthy individuals, but raised for patients experiencing acute kidney transplant rejection, even in its early stages. The IDxSense technology is a fluorogenic peptide, optimized to react with the active site of the granzyme B. This is the first test capable of measuring physiological levels of active granzyme B in human tissues, fluids, and live cell cultures, and reports the lowest limits of detection for active granzyme B to date. The technology can be used on a 96-well plate for clinical testing, along with flow cytometry for research, as well as in near-patient testing devices. The introduction of IDxSense for transplant monitoring will provide benefits for patients and healthcare systems, as well as organizations looking to monitor responses to new transplant rejection therapies. Over 600,000 patients received renal replacement therapy, dialysis, or transplant in the EU in 2019. The average cost of a core biopsy is €2,000 to €4,000, with at least 1 in 10 biopsies requiring a second biopsy. By making use of frequent urinalysis measurements from patients during their first year, we estimate that the IDxSense test could be used to monitor for acute rejection in at least 0.6 million tests in the UK alone each year. We have completed commercialization studies and preliminary clinical validation for this IDxSense technology. We've secured intellectual property rights and are looking for further investment. The IDxSense team look forward to discussing this technology with you.